Hey, here we are once again for Summit Healthcare's in Angie Fabian's office, hanging out at Summit Healthcare. They're working diligently next door on the new upgrades and the new buildings, and a little rainy today. And it's rainy today, so it's going to tie into what we're going to talk about. I've got with me Debbie Wood. How are you?
I am great this morning. I'm glad to be here.
Yeah. So Debbie is a registered nurse, and that means a whole lot of work and a whole lot of knowledge. And my mother, having been a registered nurse, I understand the amount of devotion to dedication and what you go through.
Super.
Mother-in-law is also a nurse too, so I'm a registered nurse. But anyways.
You are well taken care of.
Yeah, or everything's a sickness. One or the other, I'm not sure. But so Debbie, you work in the ER department.
Correct.
And what do you do specifically there?
I work on the floor as a nurse, but I also am titled as the trauma coordinator and also the ER outreach educator for trauma prevention. Mm-hmm. So I get to go out and try to prevent some traumas coming into the emergency room. Okay,
so I kind of like that in any position where you have a person that actually does the field, the actual real work, and then also is the outreach. That means you're really connected to things that are happening in the here and now.
In our community, right. Yes, that's our goal.
Okay, so when you say trauma outreach, what kind of things are you looking for, or are you looking to educate people about?
What we like to do, well, it's a wide range. Trauma is a wide range. My specific goal is to prevent any traumas coming into the ER, or at least get the education out there, just an awareness of multiple things. We start with anywhere from our little guys to, helmet safety, bicycle, motorbikes, ATVs, stuff like that, shopping cart. Safety is becoming huge now, so we've had multiple traumas, head bleeds, coming in from children, falling out of shopping carts, and just, a lot of preventing those traumas from those children.
So it's interesting because I know that recently the two biggest places that have shopping carts, Safeway and Walmart, both got new shopping carts. So I wonder if that has something to do with that, or the fact that people are now running them faster because they're not old.
Probably both.
All of the
Who knows? And that's one of the goals we're trying to find out.
Okay. Very interesting. So helmet safety is a big thing, isn't it?
Yes, it is.
Yeah. And anywhere from bicycles to motorcycles or all of that, right?
The big misconception out there is people say it's not cool to wear a helmet. So we're trying to get that out is, yes, it is. It is cool to wear a helmet. Not only cool, but smart.
Yeah. So having almost a decade in motorcycle safety training, I can tell you this, that if you're going faster than you can run, that's when you want to wear a helmet.
Super.
So, that's in it. That's the little skateboard things and things like that. And you got to think about it because, human body is set up pretty darn well to defend itself, but it wasn't designed to go any faster than you can run.
I think I just found someone to come out and help educate.
Well, there we go. Cool. Okay. It's raining today, and it's a little cold. So what do you expect to see today, and what would you like to prevent if you were to talk to people earlier about it?
Okay, so a little bit of background here. As a trauma coordinator, I'm able to travel around the state, and we meet as anywhere from level 4 to level 1 trauma coordinators as a group with also the Arizona Department of Health Services, DHS. And as a coordinator group, we recognize things that we're seeing in our communities as becoming a high demand, and that high demand is falls. That for care for those falls. One thing that we also do as coordinators, or as the trauma coordinators, is we take in the traumas that come into our emergency room. We input that into a database that goes to the DHS. Mm-hmm. At the end of the year, they compile all those numbers. And so with our 2016 data that has come out, the state of Arizona has showed over 195,000 falls.
Wow.
With close to 900 deaths just from slips, trips, and falls. And those slips, trips, and falls are preventable. So how many of those deaths could have been preventable?
Wow, that's pretty significant.
It is. And it's something that's not aware, that we, or even the public, are really not aware of, that it is becoming a big problem. A lot of it is with our older adults, 65 and above. But so our big thing is just trying to get an awareness out and an understanding that those can be prevented, and give them ideas and ways to prevent that.
Right. Now, you said something during all of that. You said something about levels. And I know levels. I've heard of level 4 through level 1. And I know from motorcycle training and a lot of riding, level 1, the first one that pops in my mind is Scottsdale Osborne, because that's where everybody got flown to during a motorcycle crash. So what's the difference between the levels, and then what level is the Summit ER sitting here?
Okay. So the different levels is what can that hospital provide to that patient. So a level 1 has everything. They have the trauma surgeons, the multiple surgeons, the multiple specialties that can treat those injuries. Those are the level 1s, and they drop down to 2, 3, and 4. Summit is a 4.
Okay.
So we are a 4. We actually are trying to reapply in March and April for a level 3.
Okay.
With a couple of surgeons that are coming on. So we're excited for that. So that's our goal. We're pushing towards that. But it's just with how we're able to treat those specific injuries.
Yeah, and that doesn't mean that the level 4 is any less than a level 1. It's just the availability of services, correct?
Correct.
Yeah.
Correct.
And you wouldn't expect us to have, in the rural area that we're in, the same kind of things that you'd have sitting down in a metroplex.
Right.
Yeah.
Right.
And even in the metroplex, there's only 1 or 2 as far as I'm aware of down there. So, yeah. Interesting.
We are capable of treating, many injuries, and our knowledge is there. The doctors are super, but in case we need a specific surgeon, then they are transferred out for that specific,
Yeah. Okay. So, what other things are you looking for? I mean, obviously, slips and falls, helmets, things like that. Are there some other? What is the largest amount of things that you see come into the ER? What's like the number one injury or whatever?
Right. So, speaking on the terms of slips, trips, and falls. So because in our last trauma coordinators workshop meeting, they are pushing for this fall. So we're trying to come up with this program to get that education out there. So that just kind of sparked a little interest in me. So for the month of February 2018, as the trauma coordinator in the ER, I reviewed every chart that came in, and I counted and identified any slip, trips, or fall patients. Okay. So this might be interesting to you. In the month of February, we had 92 falls that came in to our ER for treatment. So 71 of those were discharged. So they were falls that just had, no bruises, some lacerations, some concussions, something that didn't need to be, cared for further. The admits that we had were 17 admits in just the month of February that needed to have further care, whether they were broken bones, broken hips, head injuries, head bleeds, stuff like that. And then we also ended up transferring out 3 of those falls to a level 1 facility.
To a level 1 facility.
Because of those injuries were that severe.
Wow. So that's almost like a little quick math. That's more than 3 per day.
Correct.
And obviously they don't all come in, 3 each day. So you've got days where you had a whole bunch, and then others where you had none. But that's pretty wild.
It's startling when you stop to think about that. When you take it down to that month, those numbers. So I'm following March this month, and I'm only up to the 13th of identifying those, and we are at 33 right now.
So kind of on track again.
Yeah. So we were thinking maybe February would just be high because of the weather, or something like that. But in identifying those falls, we've also documented how they fell. So the highest ones are: we fell out of the tub, we fell in the bathroom, fell off the toilet, lost their balance, tripped over the little lap dog, or tripped over their oxygen tubing.
Right. So basically, stay out of the bathroom. No, that's not.
Bathrooms
that's
is
not
huge.
Going to work. Pay
Bathrooms
attention in the bathroom. Yeah.
Exactly.
Be more aware in the bathroom.
Be more aware, and then also prevent.
Right.
So what can I do in that bathroom that's going to help me not fall in that bathroom? So that's when you get into installing the handrails, or putting the raised toilets up, or taking out that extra rug, or that slip rug.
Okay, so let's just talk for a second. We've all slipped, tripped, or fell. Everybody. It's all happened. And the thing that you always go back to is, wow, if I'd have slowed down a little bit, I would have been okay. And that's typically, sometimes like, I wasn't paying attention, but it really wasn't the paying attention. It was that you tried to transition from one thing to another quickly, and it's just slowing down. So it's honestly, that's the number one thing to avoid things, is just settle down and relax a little, right?
Recognizing that sometimes you just don't do things like you used to.
Yeah. Well, there's that too. We
Yeah.
don't.
We don't like to admit that.
And us men, we don't admit that at all. We're exactly as we were as 20, and it all works the same, right?
Right.
And no, but yeah.
Got it.
Very good. I want to, before, is there anything else that you want to focus in on? But I'd like to go back and sort of end with one, but is there anything else you want to focus in on?
Just make sure about preventing. How do we prevent falls from home? So like the few we talked about in the bathroom. One that we also find is people transferring out of, or even just being transported in the wheelchairs will fall out of the wheelchairs.
Oh, yeah.
So seatbelt for wheelchairs, and don't forget the activity. So as we get older, we need to maintain our strength,
Right.
our balance, and our coordination. And so being able to have a program that will help maintain those is going to be huge in helping to
Yeah, so if you don't use it, you lose it.
perfect.
Yeah, kind of thing.
Yeah. Love
Awesome.
that.
Cool.
Big sign. I can
Yeah.
see it now.
Very good. Okay, so back to the shopping carts, because I think this is something we could probably, if everybody just sort of pays attention and realizes that this is an uptick, and it probably has something to do with, like she said, being new, and the fact that, you're not moving around. So let's just focus on, and then that's back to slowing down, right?
Right. So I think a lot of it has to do with just not an awareness. It's something that we do every single day, and we don't realize the dangers that are there. So do the kids stand up in the basket? We're not using the seat belts. Do they stand up in the seat? Also, and then riding underneath it, a lot of parents think that's great just to put it underneath it. But that's where we see a lot of the broken fingers, some broken legs, a lot of the fingernails lost. And educating that, we went to a school in October and educated the
Right.
shopping cart safety, and I had a little girl tell me that she was laying underneath the cart and her ponytail got caught in the cart.
Ugh.
So then she got a beautiful little haircut.
Right. Yeah. Probably didn't feel too well. I've noticed that the new carts are a little shorter. So they have a shorter wheelbase, and they're maybe even a little taller because they've a deeper basket height. So the kid's higher. So you got higher center of gravity. So you're more likely to tip because it's not as wide as a wheelbase, so it's not as wide as an area. So I'm sure that they're safe and they're within a compliant thing. But because they're different than what we were just previously using, you got to think about it differently.
Also, but what do they fall on?
Right.
Too.
Yeah, hard stuff.
Hard, solid surfaces and usually those little ones, they go head first because
Right.
they're top heavy.
Yep.
And it's just not something that is thought of. Yeah.
Awesome. Well, Debbie Wood with the outreach for trauma. So she's basically reaching out and telling you, hey, slow down, be good.
Absolutely. One thing I want to put in there too,
Please.
if someone wants home security checklist, like how to prepare to make your home safer, to please get with us in the ER. We have those available, and we'd be glad to get you one if they're interested in that.
Very good. Awesome. So just contact ER. You can get that off the website. The numbers are there, and hopefully we'll link it down to you. That'd be good. Anything else, Debbie?
No, I'm glad. Thank you for having me.
Very good. Thank you for being here. Appreciate it. Hey, that's going to be it for this Summit Healthcare's telling you, slow down, relax, be healthy.